Hi everyone, welcome to the fifth episode of Career Experts Podcast. And today we have with us Dr. Apoorva Anand, who is again another senior of mine from college. And I will not give away too much, only I will let you know that she's an exceptional dancer and she's multi talented. Baki, I think the rest of the introduction she can give you guys. So, ma'am, can you please introduce yourself?
Yeah. Hi, everyone. My name is Apoorva and I'm from India, but currently I live and work in Toronto, Canada. I graduated with a BDS degree from Manipal, and then I went on to study Master of Science in Public Health from Canada and from McGill University. I graduated in 2021 and I've been working since then. So, my work focuses on public health research and synthesizing evidence for health policy and guidelines. My interests are mainly in infectious diseases and in child and maternal health with from a global health perspective. And other than that, I like dancing, I like swimming, I like to travel and explore. So, yep, that's me.
That's a lot. That's not just that's a lot. Like I said, she's exceptionally multi-talented. As you can see, she's done her MPH from Canada. And which is one of the most popular questions that I get on Odigio is where do we pursue it from if we want to go outside? So that's why we are hosting this podcast for everyone. And ma'am, could you also tell us where you are working currently? Like you told us what you do, but where are you currently working as well?
I work at the Hospital for Sick Children, or as known as Sick Kids. It is one of the largest pediatric hospitals in North America and the largest pediatric hospitals in Canada. And I work in cardiac research right now.
That sounds good. But again, as always, you're doing almost everything together, which is great to know.
Thank
Just
you.
for reference, we have done a lot of college events together. She has been great at studying as well as doing college, as well as having research. So I think we'll talk more about that as we go on in the podcast. Okay, so ma'am, the biggest question that comes up, or which I want people to get an idea on, because everyone's like, we don't want to do an MDS, so we'll just go ahead and do an MPH, which is something which I don't think is the case, and I want to like disrupt that basically. So, why did you in particular decide to do MPH?
I think my main reason and what I tell everybody else is follow your interest and follow your passion. For me, it was that I realized during my internship that my true interest did not lie in dentistry, and that is not what I wanted to do with my life. And I think finance wise, it also wasn't the most feasible option for me. So I researched options and career options post BDS, went through curriculums, job options, job prospects, and shortlisted a lot of paths that I could take. And then the one that interested me the most was public health. And that is why I decided to go ahead with public health. This field in particular is very vast, and the thought of the many possibilities kind of excited me as well. So I think that was my decision point. I think everybody, when they make the decision, should focus on what their interest is and where their passion is.
That makes a lot of sense. And to add to that, just don't take it just because you don't want to do MDS. Like you said, like you researched, you shortlisted. I think
Yeah,
that is one of the most important things that people need to understand, that that is something that you have to do more than anything else. So,
definitely.
ma'am, why did you decide to pursue an MPH from Canada, not any other country, not India? What were the major driving factors behind this decision?
So just to get into the global landscape of it, currently for public health and global health, Canada, UK, USA, and Australia are the four options that have excellent programs and excellent future job prospects. So I was looking into these four countries initially. And then I zeroed in on Canada just because of ease of migration, gaining a work visa after studying, the cost of living, cost of education, just the geopolitical landscape, and how accepting a country is with respect to immigrants. For example, will I face racism or any such issues if I go into a different country? Will the people who are native to that country be accepting of me? So, Canada, in that way, is way diverse and way more accepting. And I think that was one of the decision points, I think. Yeah.
That does make a lot of sense because already there is so much that you have to work through. कि उसमें added cultural influences and all of that. So your
Yeah.
main motive was to do an MPH from outside so that you could settle outside, right? I mean, do
My main motive was actually to study global health. In public
okay,
health, you have global health. So I wanted to study global health. And in India, currently, only Manipal University offers global health. There is no other college, no other course. And that is a very small pool of colleges to choose from. So, which is why I decided, okay, if I don't get the education that I want in India, then I need to look outside. And and then I researched the different countries on where to go and how to go.
so, ma'am, if just a side question, which is not, the usual questions that I generally ask, but if, let's say, you've done global health, so can you also use your expertise, what you've learned in different countries? Like, can you also come back to India and work? Is that a possibility, or it's just limited to Canada?
So global health looks at this field from a global perspective, and it is not country specific.
Right.
Okay, so just because I have global expertise does not mean I will have country level expertise. Global health is more of collaborating with the people who are already in these countries working on those issues. So you collaborate with them, you work with them um, rather than going into that country and working there.
Right.
So the collaboration part is very important. You are not doing the work for someone. You are not establishing something for them and then leaving the country. That's not what you're doing. You are helping them create a sustainable health system that can continue afterwards as well. So you need people who are working there already, and you need to collaborate with them. So would my expertise matter in India? Well, I'm not sure if I have the country level expertise that I need. But at the same time, I have been born and brought up in India. I did my internship prior to going to McGill. I did my internship in India, so I understand the context well. As part of our medicine and dentistry, we did go to camps, to public health dentistry camps. We did go to remote areas, and we have seen what the health in general, the overall situation of health is like. So I think for us going to India, going back to India and working wouldn't be that much of an issue. But going to another country that is not India, that would be a huge question mark. I don't think the country, the people, the program would be as accepting, and I don't think I would be able to contribute as much because I don't understand the country level factors.
Right, right. That makes a lot of sense. Just a question that came up in my head because lots of people do have that, opinion. Let's say if they want to switch, go to different countries. I mean,
Yeah.
okay. So, ma'am, how did you go about choosing your course in college? And could you also tell us a couple of good colleges to do? Because see, there might be a lot of colleges in Canada that must be offering this course, public health course, both of global health as well as public health. So how did you go about choosing your course and your college?
Like I mentioned before, the first thing is deciding what your interest is. Once you know what that is, I mean, the field is very vast, and you need to have a focus, and you need to understand, you need to make a decision on what field you want to work in. So I was looking for MPH with a global health concentration. This meant that I was either looking at a pure MPH degree that offers many different concentrations, one of them being is global health, or I was looking for a direct master's in global health. And since I'd already finalized on Canada, then I was just looking for different college options. And I think there were three universities that were offering this course. That was McMaster's, University of Alberta, and McGill. How it's very difficult when a country has so many universities, so many colleges, and you need to find out which college or which university is offering this degree. So I always used to have an Excel sheet. In that Excel sheet, I had the different colleges or the universities, and I would include the name, the courses they offer, their fees, what is their start date, what is their deadline for application, their world ranking, their program ranking, what are the requirements for their application. And then at the end of all of that, I finalized three that were most applicable to me, that interested me the most, and that I've believed would give my knowledge and training the most value. And after I got my acceptances, McGill was a no-brainer because the program was structured and excellent. The faculty was very experienced. They were all working in collaboration with global health organizations or national and state governments. They were conducting relevant and cutting-edge research. So it was an absolute honor learning from them. And it's also very important to connect to some of the professors, to connect with alumni or current students and get their review and their feedback on the program. In general, because I was looking at public health and global health, I gave the names of these three universities, but in general, for public health, I would say University of Toronto, McGill University, University of British Columbia as the top three. And then McMaster, University of Alberta, University of Ottawa, and University of Waterloo are some of the good universities. And last thing is, I would always suggest if you're going for a master's degree, get it from a university as compared to a public college, just because of the quality of education that they provide and the faculty that are over there. It really helps with your future job prospects, and your degree is recognized nationally and internationally, even in the case of University of Toronto and McGill and British Columbia as well.
That makes a lot of sense because that will help people zero in on the places that they want to go. Just a side question: do a lot of Indians send out their applications for masters? Or in fact, was your cohort filled with Indians as well? Like, is it easy for Indians to get in?
Well, I think there were about 4 or 5 Indians. And of those, the ones who graduated were maybe 3 in my class of 60-ish.
Okay.
Yeah, but internationally, there were about 20 students, I think, 15 to 20 students. Everybody else was from Canada.
Okay. So the international acceptance in general is a little like international students have to work a little more harder. Would that be it?
Definitely, yes. And I think the kind of previous background that they look for, a lot of Indians don't have the kind of education or training that they want. The Indian education system is structured differently, so we need to put in a little bit more effort to get into the program. Also, McGill's acceptance rate is not high. It is difficult because, like I said, McGill ranks in the first 25 universities in the world. So McGill's ranking is high, the acceptance rate is very, very low, and it is difficult to get in. So you need to have an exceptional application to get into the university.
That makes sense. That makes a lot of sense.
But I would say that in general, in the university, there were a lot of Indians. So undergrads and postgrads together, there were a lot of Indians. And we have like an Indian Society Association or something like that, Indian Students Association or something like that, where there's like plenty of Indians. So it's not like Indians are not getting accepted. It's just that you have to
work a little harder.
Yes.
I think we'll move on to the application prospect of it because, like you said, I caught up on that was ki, you need to have a little more like the Indian education system, what they require, and the Indian education system does not provide. So maybe we can, give out some helpful tips on how people can prepare their profile if they're actually serious about getting an MPH from Canada. So we'll get into that soon. Apart from that, the next and the most important question, second most important question, I think, is it worth to get an MPH after your BDS degree, especially in a place like Canada, and in terms of return on investment as well?
Okay. So I think it is always worth it if you have a genuine interest in the field. Okay. And if you're passionate about it and if you do not want to practice dentistry anymore. For me, the degree itself imparted a level of knowledge and skills that I'm not sure I would have gained through experience alone. And a lot of jobs also require you to have this degree as a prerequisite. So if you want to work in this field, I would suggest, yes, you get that degree. And as terms of return on investment is to be considered, I earned back every dollar that I spent on the fees alone in my first year of working. So not counting the tax cuts and not counting the living expenses, like my salary package was enough to, like, it definitely covered all of my fees. So if you plan to work in Canada, the returns are good, definitely. But it does not make sense to spend thousands of dollars on education in Canada and then return to India and work for a salary in INR, right? Because in Canada, you might need, say, $3,000 for a monthly expense, including rent and groceries and everything, and your utilities and everything else. And $3,000 into 60 is the amount of INR, but you don't need that much INR to survive in India. So proportionally, you are spending more money and then you're getting back less money if you study in Canada and then go work in India. So if you want to work in India, I would suggest study in India and then work in India, and then your returns are good. But studying in Canada, working in India, your returns are not going to be that good.
That makes a lot of sense. That obviously makes a lot of sense. But
Yeah.
this is something which again is a very common question, because these are the first few doubts. Like, we can dwell in the rest of the things in a different podcast maybe, but about the course and everything. But these are a couple of questions जो सबके मन में होता है, and everyone's really hell bent on finding out these questions. So that's why this is something which I get a lot, if it's worth doing it from Canada.
Okay.
Okay, so so I anyways that acha, then another question which is also, let's say if a person gets into not even a top university, could you give us maybe a range of the fees? Because lots of people have also asked me this. How much would it cost to, you spoke about the cost of living, but what would be the tuition fees if someone's looking at, let's say, a range to get an MPH from Canada?
It would be between $8,000 to $10,000 per semester.
Per semester. And there are 4 semesters.
5 semesters.
5
Summer counts as 1 semester as well. So about anywhere between $40,000 to $50,000 is just the fees alone. And then living expenses would be between $10,000 to $20,000 depending on how you live. So it would be between $10,000 to $20,000 per year. So you can count about $70,000-ish.
That's, and I always recommend that if you're going in for such an investment, you should be passionate about it. Otherwise, there's no point of doing it.
Definitely. Yeah. Agreed.
Okay. So, ma'am, the next thing that I want to get onto is, how did you apply to colleges in Canada? How did you build up your profile for it? Like you said, that Indian education system does not cover it. So what are some of the things that you did and people can also do accordingly?
Well, I think one of the main things that you need is, of course, a bachelor's degree with a good GPA. So having a strong academic track record really helps. Along with that, you need really great academic references. You have to smartly choose your academic references. For example, for me, I chose somebody who supervised my research when I was in university. My second reference was somebody who was my professor, but also supervised me culturally and has been through all of my cultural milestones. Because he could see how I was able to balance both my extracurriculars, as well as my academic interest. And then the third one was the head of public health dentistry, because I figured there are a lot of things common between public health dentistry and public health in general. So I figured the head of that department the reference from him would make a lot of sense. And so this is how I chose my references. So I feel like choosing your references smartly, making sure that they have supervised you. You cannot go to, say, the dean or the associate dean just because they are very high ranking if they have not known you personally and if they have not worked with you personally. So how would they be the best estimate of your of your extracurriculars and your academics, right? Or your research skills. So just make sure that your references are right. Cover letter. Your cover letter should tell a story about yourself. It should tell what you have done so far, what you intend to do next, why are you choosing this degree, how is this degree going to help you do what you want to do, and why you have chosen this particular university. So you need to flatter them a bit as well, but you need to write your story in a cover letter. A really good cover letter can get you into Ivy Leagues. It's a cover letter that can actually make a difference. Of course, your resume, you have to build up on that. And then some universities require evidence of biostatistics for MPH. So you may need to do a certification in biostatistics if that's not already being covered in your curriculum. And then, of course, English language requirements and GRE results for some universities. So McGill required GRE. McGill did not require biostatistics, but Alberta and McMaster required biostatistics certification and they didn't need the GRE scores. So these are basic requirements. In addition to that, there are a lot other things too, but what is important to remember that it is not, so for example, your academics isn't that great. It does not mean you're not going to get into the university. What you need to do is work extra hard at building up the rest of the
aspects
the
of
factors. So it needs to be everything cumulatively. They're going to look at all factors together. It's not one factor. It's not just one factor. So you need to build up on your profile overall rather than just the one.
Right, that makes a lot of sense. And since you mentioned GRE, I'm also preparing for GRE and I'm practically dying because of the maths, but we will get to that also in the podcast.
Definitely, yeah.
Okay. So, ma'am, you mentioned, sorry, you go ahead.
Yeah, I think I know what your next question is. I think you were going to ask me about what else is required other than the basic requirements, right? Was that your question?
That was my question, but there's one more question that I got. So you said there's this biostatistics requirement that universities require. So as dentists, do we qualify it or no? Matlab,
Well,
does that qualify?
that's the thing. Well, that's the thing. As dentists, biostatistics is not covered in our curriculum, correct? So in that case, what you need to do is reach out to the universities that you are interested in applying to, and you tell them that this was not covered. So what are the certifications that you approve of? Or what are the certifications that they accept? And they may give you a list of certifications, or they may give you some kind of idea of what is expected. And then you go for extra classes or you do some online training and you get that certification and you submit that certification along with your application.
Right. Got it.
So that works. Yeah. So they accept that. They have a list of certification that they accept.
Okay.
But again, each university has a different kind of
different criteria.
A different thing. So you need to reach out to the universities that you're really interested in applying to, and then figure out one common or maybe two common certifications that would work for all of that.
Right. But you didn't do that because McGill did not require it.
No, McGill needed GRE, so I just submitted my GRE scores to them.
That makes sense. Okay, so
that
next question.
In 2019. I don't know if that's changed, but that was in 2019.
Okay. I think people can find that out, but that gives them a basic idea of what they're looking at and what they want to need. And the next question, you already know the next question. So what is, apart from the basic requirements, what are the additional things that people would need to build their profile?
Well, I think they definitely need to other than all of everything that I said before, I think research experience is one of the things that can make you stand out, because most of these universities are very research intensive, and just getting that kind of experience through in your college or through your internships or through the next job that you are doing, getting a few publications out or conference presentations or something like that can really help your profile. And it's some universities require job experience, some do not. Depends. Some would ask for none, some would ask for 1 to 2 years. So depending on that, you need to get that kind of an experience as well. And then if say they do not require an experience, then you can always go for an internship. So what I did was I only applied to universities that did not require a work experience, but I completed internships during that time. So I did a public health internship with KEM Hospital in Pune. They had a community medicine department, and I used to go with them to in a mobile ambulance, and I used to go into remote villages, and I used to be there just to provide kind of health promotional advice. There was a doctor there who would give out the medical advice, of course. And then in addition to all of this, I also worked on knowledge synthesis material, health promotional material for child and maternal adolescent health. So this kind of work strengthened my application.
That makes
So
sense.
that always helps.
Because I do have people, let's say, who have done their BDS, they've passed out, and in fact even MDS clients who want to get into the MPH field,
Hmm.
they don't, let's say they don't have any research experience. So can just additional work experience like you've done, maybe internships, maybe volunteering, will that actually help in building the profile? Because outside of college, research karna is a little bit more difficult than to do it when you're in college. So would that
Yeah.
help?
That would help, definitely, yes. Like I said, there is no hard and fast rule to an application. They look at the overall strength of the application rather than individual factors. And if your strength is in your work experience or your internship experiences, then not having such a strong research experience wouldn't really matter as
Matter.
much.
That makes sense. That makes a lot of sense. So, ma'am, the next question is, how did you get a job after your MPH? Because you said that the job options are great out there, but then job milna is very difficult anyways. So, what did you do and what can other people do?
I used to work part time. So I used to work part time, and I've been so okay. So I started in 2019 September. I started working part time in April 2020. Graduated in June 2021. So I worked 1 year part time, and and making a mark in your part time work can actually help you gain a full time job, either through references to your boss at that time or the boss themselves offering you a full-time job with them if they have that opportunity. So for me, that worked out. She offered me a full-time job with her, and I took that because it was interesting. It was based in Cape Town. It was global health research, and it was very relevant. So I went with that, and that helped me. But for my second job, after this project got over, I had to look for a second job. And what I did not anticipate was the amount of time it would take for me to get a second job. So I started applying at the end of my first job. And then I was without job for like 2 to 4 months after that, because it does take that much time. It can take on an average about 6 months to get the right job. This I know because I went to an employment services, like a government employment services provider, and I spoke to them, and I was very distraught because I was not getting a job for a long time. And I was like, I'm not getting a job. What do I do? They're like, this is normal for you. Have the amount of applications you've sent out and the amount of interviews you've gotten is actually pretty good, and this much time is usual. It just take time, especially because you're a recent graduate. So what really works is applying for the right job, number one, tailoring not just your cover letter, but also your resume for that job. You need to edit out things in the resume, or add in things, expand on certain things that is more relevant to that particular job. For example, I worked on a systematic review for hepatitis C. Okay, and this program was all about hepatitis C. So then I had to expand more about this project on my systematic review on hepatitis C, and I had to cut down the focus on the other projects that I had done. Right, other than if it's relevant or not relevant. For example, if it says that I need teamwork, then I would say that I collaborated with these many people, or that my team consisted of these many people, and things like that, or I led a team, or I led a meeting with these many people. So it really matters on how you tailor your resume and your cover letter. And once I started doing that, I started getting more interviews, I started getting more job offers. So really helps. And one last thing is networking helps a lot. I had a few people working in few institutions, and so when I was applying to a certain institution and they ask you that were you referred to this job through someone working already in this institution, and I could say yes, I have to ask that person, of course, can I include you as my reference? And they would say yes, and I can include that person's name. So that gets you an additional point, an additional bonus point. Also, having references helps in a way that if they think of someone, if they come across a job opportunity and they think that, oh, but she was looking for a job and I think she might be a great fit for it, let me forward this job to her, or let me inform this person that there is a person that might fit this job. So that kind of networking really helps. I have reached out to people I have never spoken to before, just to connect with them, conducting informational interviews with them, asking them how they reach that particular point, and just just constantly being in touch with them. These small things help a lot.
This is something that I say constantly, no matter where you're finding a job, whether it's in India or it's in Canada. These are the few steps that, see, because finding a job, no matter where you are, no matter what amount of experience you have, it's still going to be that amount difficult. Because let's say आप experience भी ले लेते हो, the higher you have experience, the more you move up the management ladder, the lesser the jobs become. So, anyways, that is very difficult. And the things that you've said about networking, keeping in touch, taking interviews, that's something which I constantly recommend to everyone and to everyone listening to this, no matter what job you're looking for. But this is something which is constant in every podcast I've done. Dheeraj sir, Sankalp sir, Juhi ma'am, jinka podcast I will be releasing. Then I did another podcast with someone who's doing her own freelancing thing, but she also built her network. She built her client base by networking. So I think
Yeah.
networking is very important, and I love to stress on this fact. I cannot stress on this more. That's why so much emphasis on it. And
There's
apart,
something I learned through experience though. Like I started off by sending in one resume, one cover letter, and just changing the name of the person it's assigned to or the name of the company. I started off from there and applying to like 30 jobs in 2 days, to taking 2 days to apply to one job, tailoring everything, reaching out to people, doing my research, and then applying. And and then it was like 10 applications and 3 interviews. So this is different. Like you understand the quality of your application really helps in getting you the job.
definitely, definitely, ma'am. In fact, the thing is, let's say as starters, when you're making a career switch, things are relatively more, you can do the thing where you don't tailor it as much because you don't have a lot of skill sets. But
Hmm.
when you have a single focus skill set in a single field, this is the quality of the application, I think, matters more than anything else when you're sending in. So that actually is something which I will make a separate video on right from this podcast so that people can get an idea. Okay. So, ma'am, what do colleges offer campus placements or job fairs? I know there's nothing known as campus placements outside, but can you just tell us a bit more about it?
Well, some universities or colleges have job fairs, definitely. I know University of Toronto had a job fair. I know some colleges in Ontario had job fairs, where companies such as AstraZeneca or Moderna would come, and like a lot of companies and a lot of health companies do offer their job fairs. Sometimes a particular institution itself will have their own job fair. So there are job fairs, but there is some nothing called as campus placement. There is for I have at least I'm yet to come across a university or college that offers campus placement. They are not responsible for you getting your job. But what they do is, at least my college, what they did was they forward every job opportunity that they come across. Even after I've graduated, I still come across a lot of job opportunities. They keep emailing us their job opportunities. So it's always nice that if they come across something that I'm not aware of, I do get that in my emails at least.
That's a good thing to have your college support you through the process because
Yeah.
not everyone has that outside. So that's a huge thing that's there.
Mhm.
So, ma'am, the next question that I have for you is what is the average salary of an MPH graduate in Canada, freshers as well as experience, and does the salary increase if you have some amount of prior work experience?
Okay, so on an average, a recent graduate can earn anywhere between $45,000 per year to about $80,000 per year. Depends on where you're working, what kind of job it is. And also depends on your previous experience, of course. But for us Indians, we coming from India to and going to Canada, um, the Indian experience does not always count for a lot. Okay, so it's not necessary that if you have, say, 1 or 2 years of Indian experience, that experience will always get counted. It doesn't mean that. It may or may not get counted, but definitely having gaining that experience during your education can help. So, for example, for me, I was working part-time for a year before I could graduate and before I could start my full-time job. So that part-time experience really helped, and it helps to add that to your CV because you have some kind of Canadian experience at that point. So that Canadian experience really gives you more of a push as compared to the Indian education, Indian
Even the
experience.
part-time experience.
Even the part-time experience, yes.
And ma'am,
In
what were
fact,
you
most
doing?
people I know, in fact, most people I know used to work part-time while doing their masters, and most of them worked in public health. So that really helped their strengthen their CV in their application.
Okay. And ma'am, what were you doing in your part-time experience? Like what, because there are a lot of different part-time jobs that people can do, but what were you doing particularly?
My research, I was doing research work, and it was focused on HIV and other STI infections, such as CV, hepatitis C, syphilis and gonorrhea, and then also some on COVID-19 research. And what else was I doing? And I was also helping coordinate a project in India. Yeah.
Okay, got it. Okay. So, ma'am, another thing, like you mentioned that you prepared for the GRE because some colleges have a requirement for it. So, how did you prepare for it? Did you do self-study? Did you take coaching? Or what were the resources that you used? Can you put some light on that as well?
I did not take coaching. I did it all by myself. I prepared for about 4 months-ish, I guess. But like of those 4 months, I think my 100% time, like 100% efforts were in 1.5 months, I think. The rest of those months were just like every day a few hours, I think. Mostly because I was still doing my internship at that time. So I did not have a lot of hours to give for the prep. I do wish I had given a few more months to a more intensive prep so I could have gotten a higher score. But nevertheless, I got a decent score and it was okay. Other than I think I used a Manhattan prep and I solved the entire book. I had an app which had like focus cards, I think, um, just to increase my vocabulary because believe it or not, GRE's English is actually quite tough. And I mean, IELTS, because of GRE, IELTS was a breeze for me. But GRE's English is tough. And so you need, like, if you need to build your vocabulary. So I think I had those focus cards on my phone, and every day I would just like go through all of these cards and make sure that I remember what each of them mean and how to use them in a sentence, how to use them in an essay. Um, and then other than that, I gave a lot of mock tests. So online, you find these different websites, and usually their first or their second GRE tests are the mock tests are free, and then for more mock tests you need to pay. So I've made a list of all websites offering free mock tests, and then each of them I created an account and I gave mock tests for each of them. So overall, I must have given like a mock test every day for a month.
Oh,
And yes, and my score, I could see like gradually it improving every day. So like mock test with like 3 hours and then work and study for the rest of the day. And then next day again, you give a mock test and then study for the rest of the day. So like that's what I used to do. So these mock tests really helped in a way for me to prepare, manage my time more effectively, because that is one of the most important things that you need to do, practice, I guess. And yeah, and then I did go for a paid testing thing in the last 2 to 3 days, just because I wanted somebody to go through my essays and give me feedback on my essays as well. So that really helped.
got it. Thank you. I will use that too for my prep.
Okay. No
And now,
worries.
what is the average kind of score that you need? Because like business schools require a great score to get into, because they're comparing it with GMAT. But for MPH, what would be an average range that would strengthen someone's profile?
don't exactly remember, but it was probably 160 in each minimum, I
Okay.
think, but I'm not sure.
That makes sense. 160 in each. My
Yeah.
maths is so bad. I don't know what
Yeah, it is
160 means.
160 in,
320 roughly. 320. You would need a
yes, minimum.
minimum. Yeah, right. Right.
Yeah.
That's still a very competitive score because 320 again is something that you really have to work hard for. I know I'm doing it. I know it. So, okay. Ma'am, one of the most preliminary questions is what is MPH exactly?
MPH is basically the study of epidemiology, public health practice, and biostatistics. It's all of it. And for those new to these terminologies, epidemiology is the study of incidence, distribution, and maybe even control of a disease. Biostatistics, as the name suggests, is a branch of statistics that deals with health-related data. And then public health practice includes building a set of resources or tools, guidelines, or policies, or designing health programs or health systems and then evaluating their impact. Knowledge synthesis, health research, health promotion, health economics. All of this can come under public health practice. And then all of this can also be related to communicable and non-communicable diseases, child and maternal health, environmental health, occupational health, planetary health. So it's very vast. You can work in any of these fields, any of these specializations, and then go into the more nitty-gritty of it, you know. So, for example, my first job was diagnostics for infectious diseases. And in infectious diseases, it was STIs. And even in STIs, most of it was HIV and co-infections. And then it became hepatitis C and then chlamydia and gonorrhea. So like that. So this was infectious disease epidemiology in global health related to STIs. So you know how like you know you can go down and down and down. You can like really be very specific. So public health is vast and there's a lot of things you can do.
That sounds like a huge field to get into. Just a side question when you were just talking about this, I thought, let's say if someone's not into research, because this sounds like a very research intensive place. So, like you said, being passionate about something, like if you're really passionate, only then get into it. But let's say people don't have a passion. So, are there any ways that people can actually figure out if they like research? Let's say मैं हूँ, I don't like research at all. But then कोई है जिसको figure out करना है if MPH is cut out for them. And is what would you say is something that they can do to test if they would fit into that field? Or maybe how to build that passion?
Well, I understand and I know that public health is very research intensive, definitely, but there are options that are not as research intensive. So, for example, program planning or health promotion, these are not very research intensive. You don't have to be much. I mean, it requires you to have a training, definitely, but it doesn't require you to practice all of it, right? Um, for example, for me, I did not like the biostatistics component of it. I loved epidemiology, I loved public health practice, but I did not like the biostatistics and I wasn't very strong at it. So my field of work, I don't do a lot of biostats. The max I've done is, I think, sample size calculation for a research project. Or I think what I will be doing in the next few months will be like just because now finally my study results have come. So now like I have data for my study. And so now I can do like analysis on it. So now I'll do some of it, but I haven't gone into hardcore statistics. I know people who do hardcore statistics, biostatistics, health and epidemiology that is related to health statistics. So it depends. You can choose your field based on your interest. If you don't like health research, choose something that is not related to health research. There are lots of fields and lots of options available. With respect to your question about whether you realize or not how to understand whether you're passionate about research, I think the only way you can do is just like do a small study or be a research assistant
Right.
to somebody in either in India or like the internship that I did at KEM Hospital in Pune, they offered some kind of programs where you could do small pilot studies. Like you can design your own study, and then you can go and administer questionnaires and things like that. So, and then analyze the results that you get. So they did offer those kind of programs. So maybe after doing your BDS, you can go with those kind of programs and just see if that is something you like or not. You can also attend workshops that offer kind of some basic research training and see if they find those workshops interesting. If they
Right.
don't, then you know that you don't want to work in this, right?
Right.
So I think some of these are some of the things that can help.
That's actually pretty informative, because if someone's really serious about it, I think you need to put in the effort to get into this field. Okay, so ma'am, another thing which again came when you were talking about this, so what is the, like, you had a group of 60 people, like you mentioned, like your cohort was of 60 people. So does being a dentist give you an advantage, and what are the backgrounds that people come from? Does our degree give us any advantage whatsoever in the course somewhere?
It's funny because it works very opposite in Canada. In Canada, people don't apply to med school or dental school right out of high school or college.
Right,
They do their bachelor's, they do their master's, and then they apply to medicine or dentistry, sometimes after bachelor's, but sometimes after master's as well. So a lot of people I know were planning to apply to med school or dental school after completing public health degree.
right,
And then there was me, and there was another Indian who had done our MBBS. He had actually done his MD in community medicine, and
right,
and then there was me who did my BDS, and we are here, and we are like, okay, but we don't want to practice medicine or dentistry anymore. So it's different. Public health, my cohort had a huge variety of people. There were nurses, there were dentists like me, there were doctors, there were people who had studied economics, people who had studied biostatistics, people who had studied neurology, microbiology, pharmacology, things like that. And so I think it was a very interesting mix of people, and it is not necessary for you to have a certain kind of previous degree. I think
right.
anything works as long as you know how to strengthen your application, how to spin that into your cover letter, and how to um, talk about how your undergrad plus this master's degree is going to help you in your future prospects.
Right. That makes a lot of sense. That's actually a good thing to know. Okay. So, ma'am, what are the job prospects like after doing an MPH from Canada, in Canada?
um, in Canada, it is good. Like I said, it does take some time, and you need to be patient and need to start the job hunt early on. The field is vast, so you can work in the field of health promotion, public health research, public health program design and implementation, program evaluation. You can be a data analyst. You can be an epidemiologist. You can be a health policy analyst. You can even work with the parliament on building some health policies, passing some bills, helping them do their research. I know some people who do that as well. You can go into health economics and public health consulting, things like that. And some or all of these jobs could be found in NGOs or government, public health organizations, state or national, or even local public health organizations, private organizations, hospitals, universities, um, and yes, all of these. And Canada has opportunities and institutions for everything. There are enough opportunities if you know where to look at them. And as far as global health is concerned, because I was doing global health, Canada does not have a lot of opportunities in global health as compared to USA and UK. They do have education that's focused, but compared to like job prospects, I wouldn't say not as much as UK or US.
Okay. Got it.
Yes, but I mean, Canadian government does offer a lot of funding opportunities for health research programs or health programs in general. And so because of all of this funding, there is a lot of job opportunities. So that helps. One thing I would mention is that the competition is high too. There is very
Right.
high competition for all kinds of jobs. So it it is very important that you build on your profile from the very beginning. So suppose you're starting your first year at university, take that first semester to like get used to the program and the curriculum and people and everything. And then second term onwards, maybe start a part-time job and start building on it. Start preparing. And say suppose your focus is infectious diseases. Find a part-time job in infectious diseases. Start profiling yourself from very beginning. So that helps a lot.
That's a very good tip, and I think this podcast not only will help people get in, but get a job after it as well, because which is
I
very
hope so.
important.
Yeah.
I hope so too. I hope so too. Okay. And ma'am, another thing, does everyone get a job? Like, is the placement rate good? Even though you said it takes time, but is it that everyone gets a job?
Well, I think my answer might be a little biased because I'm from McGill. And like I said, McGill is one of the top universities. And so people from McGill get placed easily. Like they get
Right.
their jobs way more faster and easily
Awesome.
as compared to other universities, I guess. So I think that really helps. But I think from what I heard from my university, most of them got either a permanent placement or at least like a temporary contract. And they had and then the temporary contracts get converted to a permanent position after a year or so, or maybe after 2 years. So most of them did quite well.
Right. Okay, that sounds good. I mean, if you get in, I always suggest if you are going outside, get into a good college or don't get into it, because there's no point spending so much money and then, be at that crossroad all over again that you are not getting a job. That's something that
Exactly.
I always suggest and recommend.
Yeah. Yeah.
Okay, so there is a very controversial topic that I want to pull up today, which is controversial, and I think it's controversial. But what I feel is that people use MPH as a pathway to get into a particular country and then apply for DDS. But I feel that MPH in itself is such an extensive course that, I mean, people can take other courses like doing a hygienist course and all of that. So, what's your take on that? What do you think about this doing MPH and then getting into med school or dental school, however?
Yeah, I think no, don't do that. Because number one, you're spending thousands of dollars on a course that you're not going to pursue in the future. If you have no interest, do not do that. If you don't have the aptitude for it, don't do that because trust me, these courses are very intensive. And I know a lot of people who fail in their first semester, and you cannot fail, at least at McGill, you cannot fail more than two subjects at a time because if you do, then two I think you can't fail two subjects period, not at a time, because if you do that your study permit is revoked and you're sent back to the country. So if you don't have the interest, you're not going to put on your efforts, and if you don't put in your efforts, you're not going to excel. So and why would you waste like 2 years of your time doing something that you are not going to pursue, right? So in terms of everything overall, I would suggest don't do something you're not interested in. If you want to go for dentistry in a different country, then choose pathways to that. Okay, there is a course called MSc in Dental Science. This is dental research. But if you do MSc in Dental Science and side by side you prepare for DTS, that could help. Do a dental hygienist course, do a dental assistant course, do
Right.
any of these courses, get those certifications while you're preparing for your DDS or your any of your other degrees that help you practice in a different country. So there are a lot of pathways, but select the pathway that makes most sense to you. And if you want to study something, if you want to do if you want to work in some place, make sure that overall it's going to help you in your future perspective,
That
right?
makes a
If
lot of sense.
Yeah.
Because, I mean, like you said, it makes sense if you're doing a hygienist course or maybe a assistant course or maybe the master's in dental sciences, I think you said. So if
Yeah.
something like that, if you're doing, then it makes sense. Otherwise, MPH, like just listening to MPH was so much. Doing that course for 2 years, I don't know how it must have been for you. Okay.
Yeah, and also, going back to my Excel sheet thing, you can always just make an Excel sheet, go to different colleges, see what courses related to dentistry they offer. Make a list of all of these courses. Try to understand what the curriculum is, what people do after this. Do that and learn that if you want to get into a country based on like through the education route, then do that. Okay, so I think colleges have a wide variety of courses, universities and colleges alike have a wide variety of courses that can be related to dentistry. Do the research, get into these courses instead, and these will help you later on when you want to find a job too. It also helps you be in touch with dentistry.
Right. Of
Right? You don't
course.
want to lose your touch with dentistry if you want to do that in the future.
Right.
So stay connected to what you want to do.
Right. Right. That makes a lot of sense. Okay, so that's it from my end. These are the questions that I had based on what I feel people generally ask. But is there anything that you would like to say to the people who are actually on their journey? Maybe they've thought about a couple of courses and this podcast, they're listening to this podcast. So would there be something that you'd like to help people who are going to start or on their journey to MPH in Canada?
What I would say is that while you're doing your internship, just kind of assess if any of the MDS options interest you, because there are so many MDS options, right? So through each of these MDS options, just go through them and see if any of these interest you while you're moving from department to department. See if like, yeah, I find this interesting or I don't find this interesting. Because if you find it interesting, I would suggest stick to it, no matter how difficult that pathway is. But if you don't, then, and if you're not passionate about it, then I would say research the hell out of programs, because it's not that you can do health administration. You don't have to do public health. You can do health administration. You can do an MBA. You can do so many other things after dentistry. So just research on that. Make sure you understand what options you have and then make a choice. Once you make your choice, talk to the people in these programs, understand what you need, and start building your profile. Take a year. You don't have to apply immediately. It's fine if you take a year. In that 1 year, gain the experience that you need or gain the certifications you need. Prepare for the exams that you need to give. If suppose your English isn't your forte, isn't your strongest forte, or it isn't something that you're good at, then take classes for like 4 to 5 months. Then give your IELTS exam. Then see if your score is good. Because these things really help a lot. If even if you're not going for Canada, if you're going for another country, say maybe Germany or something, you will need that 1 extra year to prepare, like for your to get that language proficiency in German. So take that year to just like understand what you really want to do and build on your profile, build on your proficiencies, and then you apply. That's what I would say.
That's a very good advice. That's something that even I recommend to anyone that think about it. Do your research, take your time, then get into it. This is the like just directly getting into something is the worst sort of a way that you can approach something because you're not really looking at like this is something which a lot of people have said to me that 2 3 years down the line it's not going to matter in the next 30 years these 2 3 years won't matter, so just go ahead and take in that time and give that effort
I
in.
would agree. Yeah.
Okay, so thank you so much, ma'am. Thank you so much for doing this with us. And we hope that this podcast gets viral and we make you famous. And thank you for supporting a small business like us. And we will definitely do this again when we get the time. But thank you so much for making out the time for us.
Glad to do it. Very happy to do it. Yes, definitely.
And मेरे को इतना information मिल गया, so I'm assuming that everyone who's watching this for the reasons that they're watching it, which is watching or hearing it, I really hope that it actually helps. And if it does, please leave us a comment and let us know if you have any more questions. We can definitely get back to you with more informative stuff. Thank you.
Thank you so much for having me. It was my pleasure. And I really hope this helps a lot of other people too.
I hope so too.
Okay, then.